Welcome back to the Doc Talk podcast. And we are so excited because now we have a parallel part of our season where we are going to be recapping the incredible show called The Pitt. We're so excited to dive in what's become one of our favorite medical dramas. The Pitt has been nominated for 13 Emmys and it is sweeping award season. And it is very clear why that's happening because it's so good.
And it's not just fans. I'm an ER doctor, as you all know. And so this is actually my world every day. I'm also in talking to a lot of my healthcare worker colleagues. They are loving this show. I've been so blown away by The Pitt so far. Its accuracy, the details that they've gone into, making it so heartfelt and real. And Sheila, you as a family doctor, you've seen parts of this world too. We both lived in a lot of chaos, heartbreak, and even humor within our lives as medical professionals that also are portrayed really well on screen too.
So what we're going to be doing this season for this special edition of the Doc Talk podcast is that every other week we're going to be breaking down an episode of The Pitt. We're going to talk about the cases and bring in perspectives from real life colleagues who have walked this path, and especially Shaz, as you are an emerge doc. I can't wait to pick your brain as to like what's real and what's not. We're also going to be like unpacking the real world medicine behind the drama, and it's just going to be really, really fun and just to be able to do this with you.
And so season 1 has already aired. That was kind of last season or last TV season. And season 2 is set to air in January of 2026. So what we want to do with this parallel season is actually to catch you up and rewatch season 1 to get ready for award season. We want to hear from you too. So what resonated, what scared you, what made you curious about life inside the emergency department? So be sure to also send us your questions and comments and we'll feature them in future recaps. Spoiler alerts though, we are going to be discussing the cases as we go, to be sure to follow along and share your insights as well.
So let's get into it.
Yeah. Okay, so episode 1, which is called 7 a.m., throws us right into the chaos of the morning shift. So the way that The Pitt is structured is that every episode is an hour of Dr. Robbie's or Noah Wiley's shift in this Pittsburgh emergency department. And so it's meant to be kind of in real time. So as we see kind of in this first hour, Dr. Robbie clocks in, he's got his coffee in hand, he's got his AirPods in, he's walking into the ER and walks through the jam-packed waiting room and really right away introduces that chaos of what a real day in the ER is like. We also get introduced to a fresh crop of interns, residents, and medical students in this episode. And then, of course, those traumas start rolling in.
When Whitaker says, like, is it always this busy? And she answers with, no, it gets a lot busier. Shaz, like, tell me what that's like in the emerge.
So I can't, this is such an accurate portrayal of what the waiting rooms are like in our ERs. And so I love that they kind of go back and forth to the waiting room quite a bit. And it is always like this hustling, bustling, kind of chaotic environment. And I have to say the accuracy of how they've portrayed this is spot on. It is kind of chaos right from the beginning. When I walk into my shift, I feel the same way. You're kind of like walking through the department, getting a lay of the land, seeing how many ambulances are lined up, seeing kind of what the waiting room looks like, and really getting a sense of what to expect as the shift goes forward.
Wow. And, so in this first hour of the shift, we're going to be seeing a lot of different things. We see a subway hero with a devastating injury, a triathlete who collapses mid-race, a kid who's accidentally consumed pot gummies, and a mom who's vomiting, but really just really terrified about her son's violent writings. There's so much here in this first hour that we're introduced to.
And then on top of that, what I really love about how The Pitt is portrayed is that there's all of these layers on top of those medical cases. So there's these this banter and humor that kind of plays into it as well. Like that, in the first couple of minutes, that naked man, the naked patient, running through the hallway, the handovers constantly being interrupted, the nurses who are kind of running around, the quiet moments of humanity that help us survive the chaos. And so they did a really good job of layering in all those complexities too.
So Shaz, we're going to deep dive now into the episode. You mentioned that when you walk in, you're doing a bit of a scan of the room, and that is what we saw as the first scene. Tell us a little bit more about this is actually how your shift starts.
Yeah. So for me, so sometimes I bike into work. Sometimes I'll drive into work. And so if I'm biking into work, it is I really just try to tune out the world around me and really just get into the right mental space for the chaos of an emerge shift. I always have my beverage, my coffee in hand, especially for a night shift or an early morning shift. Like if I'm waking up for a 6 a.m. shift and I'm getting up in the 5 o'clock hour, like the coffee is my savior in that moment. So I don't leave home without it. And then if I'm driving to work, like the way that Dr. Robbie had his AirPods in and just kind of like listening to music, I will often listen to something that's like chill or just kind of getting me in the zone before I'm getting to work. So I'd say that this is quite accurate, even down to his outfit, like with the coffee in hand, the hoodie. Emerge docs are kind of known for being very casually dressed at work. And so they really nailed that as well.
Well, I feel like the emerge docs are the coolest doctors in the business. Like family doctors are really casual. We're kind of chill. Emerge docs just have this air because you don't know what's coming in and you just manage it. Like I know basically what's happening in my day generally as a family doctor, but as an emerge doc, you really don't. Like it sounds exciting, but it can be, to me, it's kind of terrifying. And then I imagine walking in and seeing if you're coming in after a bad evening shift, like what we're seeing on the board there with all the patients who are waiting, like that's a whole other thing.
Yeah, that scene really resonated too, because there's this moment where they kind of look at the board and they're like, well, what happened? Like, what's going on? What happened last night? And then Dana, the charge nurse, she's amazing. She's so amazing. And like, again, they really dialed in her character as well, because that is like, Robbie calls her the ringleader of the circus. And that could not be more accurate. Like really having an amazing charge nurse that is able to look at all the puzzle pieces and take all the phone calls from like EMS coming in or other transfers coming in, move things around, shuffle people around rooms in and out of the trauma rooms just to make room for these people. Like the emergency department would not function without a charge nurse. And I love how Dr. Robbie specifically mentions that to the new team of leaders. Like he kind of does this introduction, but then specifically points out that Dana is the one that is running the show here.
Do what she says when she says it. That is exactly what I tell my residents and medical students on any rotation that you're on. Your nurses know your patients. They know what's going on. They are incredible. And like having worked in many different settings, nurses save lives before we even see our own patients. They are an incredible part of our healthcare system and undervalued. And this is something that we get into with the Pitt as well.
And then, we see later in that episode where Whitaker is kind of seeing one of his patients that he thinks has a gallstone and diagnoses it on bedside ultrasound, talks about some like diet modifications. And as he's walking out, one of the nurses says, well, hey, do you want to order an ECG too? And he's like, well, why? Why would I want to do that? And she mentions to him, well, actually, epigastric pain or pain in the abdomen can actually, like a heart attack can present that way. And he's like, oh, that's actually a really good idea. Thank you. And so like that is a perfect kind of illustration of how much trust we have in our nurses in the emergency department. When a nurse comes up to me and says to me like, hey, I'm worried about this patient, or what do you think about this? Or do you want to try this? I listen to what they say, because they are the ones that are at the bedsides with the patients a lot more than I am, as I'm kind of jumping between patients, seeing traumas, working other people up, and then coming back and circling back. They're the ones that are seeing the patients more frequently, noticing subtle changes in their vital signs or in the way that they appear. And so anytime a nurse comes to ask me or kind of mention something to me, I take it very, very seriously.
That happened to me, Shaz, when I was a medical student. That exact moment, I remember seeing that scene and being like, oh, so many parts of the Pitt resonate, because it takes me back 20 years into being a medical student and feeling the same way. And I had moments where nurses would be like, hey, Sheila, like, maybe you want to like think about this. And I appreciated that so much, because those were really key decision points that I missed as a medical student because I was learning and they just knew it. So lots of gratitude and a big shout out to all the nurses out there who may be listening.
Mm-hmm. So then I would say this is probably one of the most impactful scenes of episode 1 for me, where Dr. Robbie goes to find his colleague who was working the night shift, Dr. Abbott, on the rooftop. And this was such an important moment for me. So, when Dr. Abbott talks about like the specific line that he says, I must have had a reason at one time to keep coming back, I have to say that was the line that I felt like right in the middle of my chest, because it is something that as an ER doctor myself, I wonder that every once in a while when I go to work, especially, he talks about having to work on a vet that he ended up losing, that ended up dying. And so when we have those traumatic moments like that, where you lose someone that you just want so badly to live, when there are terrible cases that come in, honestly, it makes me sit back and like reflect on, why do I keep coming back when we have to like carry all of these heavy things? It sometimes takes a lot of effort to come back after shifts like that.
Absolutely.
Okay, so let's shift gears a little bit. We want to actually dig in a little bit into the cases that they presented in hour one of the shift. So the first one that we see is this subway trauma. So there are two patients that come in. One that, we kind of learn or we wonder, did someone jump onto the track to save this other woman? So there's a man and a woman that come in. And the first one we see is the man who jumped onto the track to try to save this woman. So that one is what we see first off.
Yeah, and it's really brutal, chaotic. Like that whole feeling in that moment is really overwhelming. And, Shaz, like the word degloving is actually one of the most accurate terms I find in medicine. My husband actually had to leave the room during this scene because it was so graphic. I sort of just like stared closer because I thought it was really fascinating. But have you seen degloving injuries? Is that something that you've experienced?
Yes. So, the degloving injuries are exactly what they sound like. And if you've watched along with this episode, it's basically where the skin is completely gloved off of a limb of some sort. So whether it's an arm or a leg, and all you see underneath that is the muscles and the tendons. And I have to give credit to like the makeup artists or the people who were in charge of making things look realistic, because it was spot on. Like that is exactly what you would expect to see with a degloving injury. And then beyond that, just the chaos, that controlled chaos that we see in the trauma room. Everybody, like this patient gets brought in, rolled in on an EMS stretcher. You go into the trauma room, and then everybody kind of has a role. There's the leader who's kind of running the show. It's like it's like kind of, conducting an orchestra essentially, where, someone's doing a bedside ultrasound right away. Someone's assessing the airway. Someone's doing what's called a primary survey. So doing a head to toe exam to identify any injuries. There's, someone that's drawing blood work, someone that's hooking up the patient to monitor. So all of these things are happening simultaneously to get the patient care as quickly as possible. And they really highlighted that well in that scene too.
Yeah, a little backstory around that is that they actually didn't pair music to the scenes because they wanted to show and have all the sounds of that moment and that orchestration of how people came together and how loud it can be, how you have to have that leader at the beginning and also like who's directing things, but everyone's talking and sharing. It's all coordinated. So they didn't actually put music behind any of these scenes because they wanted to show the authenticity of how chaotic and how real it can really feel. Mm-hmm. Our next case that came in was really interesting because it was a bit of a confusing picture at first. It was a triathlete that collapsed and kept on having to be resuscitated. And he's a healthy young individual. It was really confusing. And what was really interesting about this is that Dr. Robbie came and Dr. Collins was evaluating. And Dr. Robbie's like, he has this situation going on. We don't have the labs back, but we're going to intervene. And often, especially when we're earlier in our career, we're really following those protocols, right, Shaz? Like we're waiting for blood work to come back before we intervene. And this is really something that's known as like clinical judgment. Like Dr. Robbie has 20 years of experience being a ER doc and has seen these things, and he intervened before, and it created a little bit of tension.
Yeah, that was an interesting scene to watch because in that moment I was reflecting on, so I've been in practice for 10 years now. Dr. Collins is a fourth year resident. And I was like reflecting on like, what would I do in that situation as if I were like in Dr. Robbie's shoes? And I feel like I think I would have waited. We typically get like, so that this patient had very high potassium, which can have quite profound and negative impacts on your heart muscle and the conduction of electricity through your heart, which is why he continued to have these cardiac arrests and his heart would stop and they'd have to, or go into like an abnormal rhythm called ventricular fibrillation, where they'd have to defibrillate him or shock him to get his heart moving again. And so it was a really interesting balance between a seasoned emerge doc that was like, nope, I've seen this, I know what this is, versus someone who was still trying to like figure out how they want to practice. So it was a really interesting scene to watch. So the next one, so as the listeners know, I also do pediatric emergency department and certainly have seen cases like this. So this one was the one of gummy ingestion. So we see a scene where parents are panicking with kind of a young toddler who's clearly super tired, has all like normal vital signs, initially has all normal blood work, and is still really sleepy. And so what they end up with investigative work, Langdon asked some questions, Mel was in that room as well. And they were trying to kind of, ask questions and figure things out. And it ended up being Langdon in the end that noticed that there was a bit of a sticky substance, what looked like a gummy in this child's mouth, and then knew to ask some questions to the parents. And then we end up finding out that he likely got into cannabis gummies, and that was what was causing the situation with this young child.
So I felt like this was such a good PSA for anybody watching who may use edibles. Many people do. In Canada, they're legalized. Like, kids can't tell the difference between a regular gummy and an edible gummy. And so if, just like you lock up things like your medicine cabinet, the same thing should be true for edibles, because kids do get into it. Shaz, have you seen edible ingestion in
yes.
the Emerge?
Yes, I have. Mm-hmm.
Yeah.
And this is exactly, it is scary for the parents. It's scary for us as well. Thankfully, we know that so typically it's exactly what happened with this case, is that you just wait, and then the effects of the edibles will wear off, and then the patient will slowly wake up. But it is something that I've definitely seen in real life.
So our last story was our last big case. It's actually a case we're gonna be seeing throughout this episodes of season 1, is about Teresa and David. So a mom who comes in, who has given herself some Ipecac, which is like to help you vomit, and she's given it to herself because she's actually not worried about herself. She's worried about her son because he has some problems. And what she says is that he has a list of the girls that he wants to hurt.
So this one actually, and this one actually stood out to me because I could see, for me, the star of this scene was the social worker. So
amazing.
Yeah. And so for us, so I work in an inner city ER. We have amazing social workers in the department. They are worth their weight in gold because they have the time to go and dig into things, to have a conversation with patients, look at background information, and try to set them up with things in the community. And in this situation, for David, the social worker was able to take some time and sit down and talk to him. But the other thing I noticed as well was that Robbie was part of that conversation as well. So he also took some time, took a step back. And as an Emerge doc, there are cases where we know that it actually will need a little bit of that extra time. We're always pulled in so many different directions where, I need to see this person, assess them, get investigations in. Then I pop to the next room. I might get called away to a trauma, and it's always kind of one thing after another. But there are cases where we know that we just have to spend that extra time, whether it's that we need to ask more questions to figure things out, or to spend more time to provide care and compassion to the patient. There are these cases that come up. And the other thing that stood out to me was not just the social worker who was going and talking to David, but also that Robbie was part of that conversation as well. Even though there was so much chaos going on around him, he knew that this was a conversation that he had to be a part of and take the time to be a part of.
Yeah, absolutely. And so there's so much buzz. These are some of the first cases that we saw. There's so much buzz around the Pitt online. And one of the big questions that comes up a lot on online forums is that, is this actually accurate? Is the volume that we're seeing, the intensity of the cases, is this real? So what do you think, Shaz? I also had the same question. I was like, is this what working in the Emerge is like?
So I would say the first episode, the first hour of this shift, 100% accurate, where there's lots of people kind of coming in at the same time. You have what we learned are called boarders, which are patients who in my Emerge, we call them EIPs, or emergency inpatients, which means that they have been admitted to a service and are waiting for a bed upstairs. In this show, those patients are called boarders, where they are admitted but waiting for a room upstairs. So you see that there are boarders everywhere. The waiting room is chaos. There are, as you're trying to see one person, you get pulled to another person. There are learners around, kind of the accuracy of the way that the dynamic between nurses and the charge nurse and physicians and med students happen. I would say those are extremely accurate. Now, as we move on into the season, so spoiler alert, there is a very high acuity of cases that come in, which I'm not going to, I won't spoil what those cases are, but I would say that part feels a bit inaccurate to me, because we don't typically have, these were all of the cases that as a resident, you want to see them. These are really cool procedures and rare procedures, and having all of those happen in one shift. You'd be lucky to see that in 1 year. But I think, from a production standpoint, certainly highlighting the chaos and the really unique and rare cases of Emerge, it certainly makes sense from a TV show standpoint.
For sure. Okay, so that's helpful. The next thing that we want to do is do a little bit of a deep dive and introduce you to who the characters are, because I fell in love with a lot of these characters, and I saw myself in a lot of these characters when I was a medical student and when I was a resident doing emerge shifts. I loved how the pilot introduced the learners to us. They are like, this is the entry point for us to learn about them, a little bit about who they are, and really it did take me back to med school.
Okay, so I love this introduction that we get to the characters. And so I'm going to go in order just in terms of hierarchy from like the, least trained to the most trained, just so for our listeners in terms of what that means. So MS3, so we meet Dennis Whitaker, Victoria Javadi is the MS3. So that means she's a third year medical student. So that is actually, so typically in medical school, the first 2 years are classroom based. And then third year is when you start doing your rotations. And so this is probably her first real exposure to,
as we see.
As she faints during that reduction of the reduction of that degloving injury where they're putting those bones back into place. And so that is, I would say that's fairly common. Next we meet not doctor yet, but Dennis Whitaker, who's an MS4, so a fourth year medical student, so has already had a year of clinical experience. Definitely see that he's a bit more confident, but still learning. Next we have Trinity Santos, who's an intern. So we don't use that term in Canada. They use that more in the United States, but an intern is a first year resident. So they finished medical school and this is their first year of residency and have finished their MD. So they're a brand new doctor. And then we also meet probably one of my favorite characters, Dr. Melissa King, who is a second year resident. So she's already had a full year of residency. We learned that she's come recently from the VA, which is the Veterans Affairs Hospital, before coming to the Pitt. And so she's still kind of building on her experience and building some independence as well.
Yeah, she's one of my favorites as well, Shaz. I remember my classmates sometimes fainting in different situations. Like, this does happen. It sometimes can be really overwhelming. Like, some of my classmates had never seen blood in the level that we had in the cadaver lab. People fainted. Like, this is not uncommon. And I know this is such so when that happened, I was like, oh yeah, this happens. Like, this is part of our training, is that we kind of get trial by fire sometimes, where we're just exposed to things that we've never experienced. And some of the most awful things that you'll ever see can happen really early in your career. And that sticks with you. I agree with you. Mel is one of my favorite characters. She's pretty joyful. She's kind. And she says that, up front, I'm so happy to be here. And Robbie quips back off to talk to me at the end of the day kind of thing, which is quite accurate. But I love the learners in this show.
Me too. And I really actually like the spectrum that they illustrate with these learners. So we have, Javadi, who is a terrified MS3 third year medical student who faints. We have, a bit more apprehensive with Whitaker, but we can clearly see that there's a difference between him and Javadi, because he does have that extra year of experience. And then, of course, also really interesting is with Trinity Santos. She's a first year resident. You can see that she is one of these people that's a bit more cocky, certainly is a bit cowboyish in terms of how she manages patients. And then the different spectrum of emerge residents. So we have Melissa, who's an R2, and then we will meet, we kind of meet Collins and Langdon as well, who are senior residents. And so you can also see a difference between them. With Mohan, I think she's a third year resident. And so it's really nice to illustrate that they've illustrated what the difference is between each of these levels in terms of their experience, how much medicine they know, and also how involved they are in patient care.
Yeah, they call Samira slow-mo Mohan, right? Because she does take time. And I would have to say, Shaz, that was kind of me in the emerge, which made it very clear to me that acute emergency medicine care was not the right fit for me, because I'd sort of sit there and be like, tell me your backstory. Where did you grow up? Tell me your trauma history. It was just that was very clear to me. And I really identified with her character because she was really, really into getting that story. But it also limited how many patients she would see.
And, so she does get her moment to shine later in the season, yes, which is great. But that was an interesting interaction for me, because I often wish that I could spend that amount of time getting to know my patients and their entire context before I do a workup and a plan. And, in an ideal world, I would be able to spend 30 minutes with every single one of my patients so I can have a fulsome, holistic approach. But that is not the purpose of an ER, and certainly not the way that it's going to function, because we have so many people coming in and needing to kind of triage and spend the right amount of time for each patient in terms of getting what we need before we do that workup. And then, of course, we also met Dr. McKay, who's a 42-year-old second-year resident. And so I think that this is also a really important piece to highlight that medicine isn't always a straight line, that people often have careers before going into medicine. Some of my closest friends are people who were engineers first or had entire careers first as engineers before they then went back to medical school and are kind of more mature students and residents. And I'm glad that the show was able to highlight that too.
Yeah, often having that real life experience in different ways makes you a better doctor because you understand patients and their lives in a different way as well. So I love that she's included because she's going to be highlighted later on, which I can't wait to get into her character because it's so fascinating and layered.
Absolutely. Okay, so I want to chat about what some of our favorite moments were from episode 1. So Sheila, why don't you tell me what some of your favorite moments were from this 7 a.m. episode?
Yeah, so, I think one of the biggest moments that really stood out, and I'm so glad that they highlighted this and it happens throughout the season, is acknowledgement of grief. When a patient passes or there's an outcome that isn't what we hoped for. You said it earlier, Shaz, like we are so affected sometimes when our patients don't make it through, or every time really. And there was a moment where they described that there's a moment of silence after a patient dies, and the acknowledgement of grief and our humanity is really important to acknowledge. And sometimes when we ignore it, that's when things can get really rough. There's also a letter that was written that was mentioned to the vet who had passed to the family. And I think that's such a beautiful thing when families know how much we've tried to resuscitate somebody and tried to do, like, all the efforts were made to preserve life. And so I think that's really such an important, beautiful part that they highlighted because it's true. And sometimes we, and especially in Canada, there's long wait lists for emergency rooms. People are frustrated, understandably, but we're also human and we feel the grief when we lose patients as well.
Absolutely.
What are your standout moments from this episode 1?
So this was hard for me because in general, the thing that really stood out to me, because this is my first experience with this series, right? This is the first episode and I wasn't really sure what to expect. I'd watched so many different medical shows before and really did not enjoy the lack of accuracy of them. Aside from Scrubs was pretty good, fairly accurate. I would say this one is a lot more accurate now. But it was like, just in general, how medically accurate things were in terms of the doses, the algorithms, the case of that triathlete who had elevated potassium, like the treatment algorithms, the doses, when we had that trauma come in, like, again, the algorithms. But I think the one standout moment for me, again, which is highly accurate, was the tooth aspiration. So this person who had a facial injury and was missing a tooth. And what we are taught in residency all the time is when you have someone who has had a tooth knocked out and you can't find it, you don't know where it is, always do a chest x-ray because there is a risk that they've aspirated or inhaled this tooth into their lung. And then that can actually end up becoming very dangerous for them because they can have an infection that can then become life-threatening. And so that was a really, really great highlight for me because of the accuracy of that. And really, this is literally something that we're taught in residency all the time too.
Oh, wow. Was there any moments that were like the least accurate based on what you've seen?
Yes, the gloves. That was one thing that was driving me. Two things. So not masking, although I suspect that was a very deliberate choice from a production standpoint because being able to see facial expressions is really important. And then we see later actually in the series that they have an entire little segment about the importance of masking. And so I'm glad that they highlighted that later. But the just general use of PPE, how they're like touching charts with gloves, not really necessarily changing their gowns between patients. So that does not happen in the Emerge. We take everything off and clean, and have hand hygiene and put everything back on between patients. They did show a lot of use of hand sanitizer and hand hygiene though. So I'm glad that they show that because that is something that we are super, super diligent and militant about in the Emerge in terms of like having hand hygiene at multiple points along our patient care and between patients as well.
Okay, amazing. So one of the things that we want to do when we wrap up our episode recaps is that we want to do a little bit of an awards of the week to kind of go through like specifically what is a line of the week that we found most that resonated the most, who's our MVP of the week of the episode, what's the most relatable. And so Shaz, I think both of you and I both agreed on what the line of the week is.
Yeah, and so that was that opening scene with Robbie and Abbott, where he talks about having not knowing a reason to come back, or thinking about the reason that he always comes back. And then I also, even Robbie's response, because this is the job that keeps on giving, but then he says all these negative things: nightmares, ulcers, suicidal tendencies. I would say that that's the line of the week, because it really sets the stage for the chaos and the moral distress and injury that an emerge shift brings.
For sure.
What about the MVP? Any kind of nominees or thoughts on that one for you?
I mean, I a lot of the characters really stuck out for me. I would say, like, the social worker is incredible. Again, like you said, Shaz, like, they're the unsung hero of these acute care settings, and also in our family practice, our social worker is so important to our patients and their lives and their follow up after they leave the hospital. Like, these are like key pieces of their job. So I really loved the introduction of making sure that these key members of the team were included. So I loved her. What about we talked about this a bit, but like, what's the most relatable part of the show?
So for me, I mean, we talked a lot about relatable things, but I actually really enjoyed the little banter between each of, like, you could see that there was, at the beginning, there was Dana coming in to Dr. Collins, seeing her puking in the bathroom. The interaction between Langdon and Collins at the trauma, where they're like kind of bickering back and forth. When the trauma surgeon comes in, there's bickering back and forth. And like, these are, you don't really see the arc until the entire kind of season finishes, but these are moments of bickering and poking fun at people that are truly accurate, and kind of how we really get through the day and get through the shift, and how we cope, being able to like poke fun at each other and have a little bit of lightheartedness. I would say that was definitely relatable for me.
Awesome. What about your medical gold star? Because you're the emerge doc. So tell me, what's your medical gold star?
Yeah, I mean, I talked about this before as well, but just how accurate the algorithms, the medications, the doses are. I mean, that was spot on for me. I really, really love how this show has been able to keep the medical accuracy while still keeping things really interesting and entertaining for those who aren't medical people.
Yeah, and from a filming perspective, what's really interesting about the show, when I dug a little bit into sort of how they produced it, they kept everybody, all the actors, on set for the entire shoot of that episode, because they wanted to maintain the chaos, the busyness, make sure that people were just walking around, interacting as you do and what you see in the emerge, rather than like shooting one scene and only having those characters in that scene. They actually kept everybody in the background as well. And I think that really helped with the accuracy.
I love that. I love it. Okay, do you have any take-home messages for our listeners from this episode?
2 main take-home messages. 1, lock up your gummies, parents, because this is something that is real. It happens. Kids can't differentiate between them. And the second is listen to nurses. I would say MVP's tied, actually, for nursing team and with a social worker, because nurses know what's up. They know about our patients, and they are an incredible resource.
Love it. So for our listeners, what case hit you hardest? The triathlete, the subway hero, the gummy kid? Let us know.
And who's your MVP? Dana, Robbie, or someone else? Send us your thoughts or voice notes. We want to share them in our next recap. So overall, we know, like, we're so excited to do these recap episodes. Episode 1, set the tone of the chaos, the heartbreak, the humor, the fleeting quiet moments of humanity. And we're so excited to be sharing this with you in terms of these different episodes of The Pitt.
On the next episode, we'll see if the interns survive, if Dana stays unshakable, and whether Robbie does find that reason to start coming back. I can't wait to share that with you.
So we'll see you all in a couple of weeks for our next recap episode.
A reminder that the Doc Talk is for general information purposes only. This podcast is not intended to replace medical advice from your doctor. While we are doctors, we are not your doctor. Always speak to your own healthcare provider for questions related to your personal health needs. And of course, please be sure to follow us on social media at the Doc Talk Pod and send us your voice notes and questions.